So hi everyone, it is 5 p.m. So we will start now. So good evening everyone. Welcome to Healthcare Professional at a Glance, a virtual event organized by YAHPA and sponsored by Elite College. My name is Willin and will be your animator for this first day of the event. Today's event is planned to end at 8 p.m. We will be having a total of 8 presentations tonight by following the schedule posted on our promotional posters. And if there's any changes in the schedule, I will let you guys know as soon as possible. Before I invite my first healthcare professional, I would like to explain some simple rules for this event. First, as you can see on our schedule, each professional have 20 minutes, which is approximately 10 minutes of presentation and 10 minutes of question period. There will be a small break of 5 minutes in the middle of the conference. Due to all the respect to the speaker, all questions will be only answered during the Q&A session. You can either type your question in the chat by forming a clear and complete sentence, or by raising your hand in the video call. So this slide is to show you how to raise your hand in the Zoom. Question will be answered in the priority of chronology or relevance. So it's basically first come, first serve. You are welcome to open your camera during the presentation, but we are not forcing you to open it if you don't feel comfortable. However, if you are asking a question via video and voice, we will ask you to open your camera due to the respect for the speaker. Given that 10 minutes is very short to present a whole healthcare profession, some professional might take the whole 20 minutes to present. In that case, there will be no question period. However, you are welcome to send your question to our YAHPA Facebook or WeChat page, and we will try to arrange a more detailed conference in the future if the request number is really high. We are considering making this event the beginning of a series of conference in order to help you, the student, to make a clear decision in your future career path. Second, the goal of this virtual event is to let students cover the variety of healthcare professions that exist in Quebec's healthcare system. It is not a 101 how to apply to this or that specific program. So if you're really interested in the application process of a specific program of a specific school, we will invite you to visit the official admission page of the different university to learn about the most recent and updated admission requirements. The speakers that we will have invited today are here to present you the real daily life of a working healthcare professional, and I hope that all the information will be useful to you. Finally, I would like to ask you guys to complete the survey at the end of the conference. It is to help us to improve on our future conferences. Your comment and suggestions are very, very important to us. Thank you very much for listening to my introduction, and a very big thank you to our team and our speakers who are all brilliant and hardworking people, and most of them are doing this on a volunteer basis. Oh, I think I was muted. Sorry. Thank you for very much for this making this event possible. And without further ado, please welcome our first speaker, Vida Siu.
Hi. So I'm going to present to you what occupational therapy is. If you can just move on to the next slide. First of all, I'm just going to introduce myself a little bit. So I am not an occupational therapist yet, but I will be in December. So I will get my master's degree then. My ethnicity is Cambodian, and my future domain of practice, obviously, because I will start in January, is in private clinic, more specifically with return to work cases and mental health. And I went to school at Université de Montréal. So what is occupational therapy? That's probably the first thing they teach you in school, because even your teachers can't really explain it. But according to the Canadian Association of OTs, is that OT is a type of healthcare that helps to solve the problems that interfere with a person's ability to do things that are important to them. Everyday things like self-care, being productive, and leisure activities. So that's actually a very long definition, just to say that it's, next slide, rehab with the goal of going back to an occupation. So that's a very broad definition as well. It's really hard to grasp what OT is until you actually work in the field or go through school. And I'll try to make it simpler for you guys. So in terms of clientele, you can go from 0 to 100 years old. And when I say 0, I really mean like 0, like premature babies, for example, like what's important to them, their activity, their favorite, like not their favorite, but what they need to do is sleep and eat, right? But when you're a premature baby, sometimes you don't necessarily have the muscles or the abilities to sleep properly because you're not completely developed yet. So an OT will try to arrange the environment for that baby for it to sleep better and eat better as well. So that's for like babies. And then you can also work in pediatrics with older children. For example, in schools, when a child has ADHD, an occupational therapist can help them concentrate better. So you've probably seen maybe balloons as a chair or something like that, that will help them focus. And that's an OT who will determine if that's the proper intervention for that child. And then you also have physical health. So everything that's amputees, for example, what's important to them, what they want to go back to is their daily life. So cooking, cleaning, their work. So an OT will help them do those activities as well, and adapt the environment, but also work on their residual strength if they have any. And same goes for mental health. So in my case, when I'm going to be working in a private clinic for return to work, for example, if someone has depression for a long time, then they're ready to get back to work. They have to do it progressively and in a certain way so that they don't crash back into the depression. So an OT will be there to accompany them through that, give them tips and tricks. And finally, elderly, the most basic, well, I think the most generic one that people think of when they talk about OTs because of like technical aids, especially wheelchairs, or when they're in a CHSLD, so like old people residents, they'll need an OT to have the proper equipment so that they can walk properly or even sleep properly. And then we can move on to the next slide. So where can an OT work? With the presentation I just gave you, I think it's pretty obvious that they can pretty much work anywhere. So hospitals, like whether it's general, pediatrics, psychiatric, rehab centers, private clinics, schools, even special needs school, which I didn't mention earlier, but autism, Down syndrome, those are all kids that OTs can work with, community centers, and also in research, but they'll have to pursue a PhD. Next slide. So my pathway personally, I went to CEGEP for 2 years in health science, and then I applied to occupational therapy directly. Then it's 3 years of bachelor's and 1.5 years of master's, but it really depends on which university. That's the basic pathway for French universities. But in McGill, you're able to do the master's without having completed the occupational therapy bachelor's degree. So you can do 3 years in bio and then do 2 years in the 2 years of master's at McGill. It also includes like it includes the qualifying year. So you do need to, learn all the knowledge so that you're up to par with all your other colleagues who did the bachelor's. And next slide. I put here a couple of examples of courses that you could get. So I think in all health professions, if I'm not mistaken, you'll have to go through your basic science courses. So human anatomy, physiology, biomechanics, research and stats classes, and also interprofessional classes. You'll also have later on after your first year, more OT specific courses. So you'll have to learn the frameworks. Those are models for you to help you learn how to assess a patient or intervene with a patient. You'll have other different courses as well to, give you more knowledge about the clients you'll be seeing. And also other classes like community OT, which are pretty interesting that they really want to, in general, the school wants to expose you to these more rare middle places you can work in. And for courses, the best part about this degree is that it's very practical. So you do have labs, you practice with a lot of simulations, you have workshops, and it's really fun. So especially as an OT, you're working on their daily life activities. So sometimes you'll cook something in the kitchen for class, which is fun, or you'll learn how to shape an orthesis for a person's arm and things like that. So lots of fun, but also lots of studying. And then next slide. Day in a life. You'll see that my day in life is not very developed because I haven't worked yet, but I based this off my previous stage work. So work, lunch, work, note-taking, but it really depends in which place you're working. So if you're working in a hospital, for example, in an emergency department, you'll have to assess the patient to see if they're ready to be discharged, if they can function in their daily life. Or if you're working in a psychiatric hospital, you might have to do group therapy where in the morning, and then you'll have another group in the afternoon where people can discuss how they implemented the techniques that you guys talked about in previous sessions. And yeah, you can also follow up on patients. Especially in physical health, I think it's similar to physiotherapy in that sense that you see a patient and then a couple of days later you check up on their strength and see their progress so you can adjust the exercises. And then you also have note taking. So OTs have to take a lot of notes for their assessments, for the interventions and everything. And obviously, when you work in health, you also have to work in collaboration with a lot of other professionals. And you'll have a lot of team meetings during the week and case studies in case, for example, you're stuck on a case or your colleague is stuck on a case, you guys can discuss and see what's the best intervention for them. Next slide. So pros and cons of being an OT. Some of the pros are that it's a pretty regular schedule. Your weekends are usually off unless you work in a hospital. So it's really a good life-work balance. Currently, you have many job opportunities. So a lot of my friends, they didn't have to look for jobs. Employers were calling them because, well, obviously in health, there's a shortage of people. So you don't have to worry about that. You'll have a job when you come here, when you become an OT and you graduate. And then you also have support from your professional order for ethical dilemmas. So for example, if you're not sure if you should be treating this patient because you feel like they're too close to them, you can call the order and they'll help you solve that problem. They're pretty available. And if you need any help, even with your note taken, because it's very strict, they'll help you out. You also have your paid hours for charting, which is not the case for all professionals. Since our charting is pretty extensive, it is paid and it is counted in your hours. And also what's good about OT is that you have a lot of flexibility with the clientele you want to work. So everybody needs to be able to do the activities they want and they need. So you can pretty much work with anyone. So if your children want to play like a sport, but they're missing an arm, then you can help that child out. Or if an older person wants to learn how to clean after a stroke, you can help that other person out. So it's very, very broad. As for cons, as I mentioned earlier, extensive reports that are closely supervised by our order. They're really strict on it, and especially in our formulation, the way we write things. So it's kind of a hassle, but it's good for the patient in the long run. You also have a yearly portfolio to complete, which will help you self-reflect, but you do need to, do it, which is also a hassle, but it's better for you in the long run, where you learn more about yourself and then you fix things about the way you intervene with patients and how you interact with them and the way you approach things. So those would be like 2 cons I would give OT. And next slide, I think it's the Q&A session. Yep.
So there was no question noted in the chat. And then there was someone who raised a hand, but then lowered down. Does the person still wants to answer, to ask the question? No, okay. So I have some questions for you, Vida, meanwhile waiting for other people to see if they have other questions. Do you feel like you did some internship during COVID, like prior to COVID and during COVID?
I only did it this summer, my internship.
Okay. Did you notice like some difference, or you think there will be some difference due to like the COVID situation right now?
I think there are definitely differences. So, for example, I know I'm still in contact with some of my supervisors, and one of them was telling me that everything went online. So when you're doing group therapy, for example, it's more difficult to read a person's body language through Zoom, right? But when you're in real life, you see how they're interacting with each other, their body language. So those are all things you can analyze, and then you can, make a better, take a better picture of what the person is going through. So they might be saying, I'm fine, but then their body language, they're super stressed, they're like shaking. So those are things that you're missing through Zoom.
Okay, I have a question in the chat. It's Irene asking, how much do you pay for professional insurance? Do you know? Have a slight idea?
For professional insurance or for to be part of the order?
No, professional insurance, that is the question.
I am not aware of the amount.
Okay. So can you talk about your application process and how does it work for OT?
Well, the application process is pretty standard for OT and I think most health-related professions, where you apply to the university and they don't check your extracurriculars or anything. It's really based off grades, and you also have to pass your CASPER now, I think.
Yeah.
They implemented earlier.
So for this type of question, we will invite you guys to go on the university admission page. Because of COVID, there's a lot of changes. So yes, the next question is musical therapy popular? Can you introduce this occupation?
I don't know much about musical therapists, but it's a different practice than occupational therapy, so I can't really answer that question.
Okay. Anyone else has any question? So a question from Alicia. Hi, Vida. Could you develop more on your role as an OT in mental health? Also, what made you want to pursue this field?
Yeah. So I personally really enjoy mental health because I find that talking to patients is very interesting. I think you get to build that in physical health as well, but in mental health, they're very vulnerable to you, and you learn a lot about people and also about yourself, which I enjoy. And what my role is, if I can give you an example, for example, a person has like very bad anxiety. They can't get out of the house, they can't take the bus or anything. So my job as an OT would be to help them go outside, first of all. So you'll progressively help them through their fears, but concretely. So I would literally accompany that person to, for example, the bus stop. And then eventually, next step, we'll buy a ticket. And next step, we'll get on the bus. So yeah, and you get to see the progress too as an OT compared to maybe some other professions. You're working very closely with the patient, and it's satisfying to see when there's progress. And yeah, I just really enjoy mental health because people get to open up more and you get to know more about the person.
So there's another question from Kathleen. How do we look for a job after graduating from OT? Could you develop more on that?
So for job perspectives, we at the university, and I think McGill has it too, and I think every other university, they will organize a session where employers will come and talk to you and kind of sell you their clinic or even the hospital. You can apply as any other job, even for like Maxi, if you want to be working as a cashier, it's kind of like the same thing. It's the same process, but as like in this field, some people will come to you and present what they their benefits, I guess, and you'll get to see around, shop around for jobs.
next question is from Shuaizhen. Is concussion count in not being mental health? I'm not quite sure about your question. Maybe you should formulate a better sentence. What are the prerequisites for being occupational therapist?
You do need a certain amount of creativity. It is a new field and you're always looking for solutions, which is really nice because it's a lot of problem solving. So that, and you also need to be really good at having a holistic vision of the patient. So you really need to look at the individual and its entire person. So you're not just looking at his diagnosis, you're not just looking at whether how they function. You really need to take into account their environment, their social network, everything. But that's something you can also develop through the program, and they'll help you develop that as well.
Anyone else wants to ask the question? The chat, there's no more question. Okay. Shuaizhen, I want to ask you if there's the concussion is a form of mental disease. Where's Vida?
Yes.
Oh, okay. I lost you.
A concussion is not a form of mental disease, but it is neurological, I think. But people who get concussions can definitely go see an OT to function better in their daily lives.
Okay, and we have Handsome Xiao. You can unmute yourself and open your video to ask your question. Hello.
Hi, Vida. Thank you for your talk. I didn't know that OTs were so involved in mental health work. You seem to really enjoy forming that connection with people. I'm just wondering what kind of long-term alliances are you able to form with your patients? Is it more of a short-term work, or are you able to really be involved with them for a long period of their life?
It really depends on the diagnosis. So there are patients that it depends on the department you're working with, actually. So you can work in the emergency department, and that's when you assess people and see if they can be discharged. If, for example, they had just had the psychosis, and then you decide if they can function after that, if they have all their, cognitive functions, okay. But in more severe mental illnesses like drug addiction, personality disorders, or things like that, you will be working more closely with those patients, because it takes more than just a month or a year to get over those things. So you see the patients a lot. For example, in my stage, I would see the patients almost every day, and they were sometimes patients that my supervisor had for a couple of years. So it's definitely a pretty strong bond that you have with them.
Okay. That's really cool. Thank you.
So there is 2 minutes left for you, Vida. So one last question, and it was from Jess. She was wondering how closely you work with other professionals as OT.
You work pretty closely, and I think as any other professional, you would work really close too. The thing with OT is that, for example, I'll merge it with the other questions. So if the child has a feeding problem, they can't eat properly, you'll be working with the speech therapist, you'll be working with a nutritionist, and very closely, just so that child can can eat properly and be safely so they don't choke on anything, right? Since they all have their very specific knowledge on each little part of feeding. Yeah. You also need to work closely with doctors, since you guys are the one who know the patient best. So sometimes they'll come up to you and ask you how they're doing or how therapy went. So yep, very closely.
So thank you, Vida. That will be all for today's presentation. Thank you very much for your time. The next up is Podiatry. So let's welcome Mahua. Mahua, are you there?
Yes. Hello, do you hear me?
Yes, we can hear you clearly. So I give you the role, okay?
Perfect. So hi, everyone. I'm Mahua, a fourth year, so last year student in pediatric medicine. I'm sorry if you hear some noise because I have construction at home right now. So I'm sorry for that. So first of all, what is podiatry? So a podiatrist is a health professional governed by the Code des professions du Québec, the Loi sur la podiatrie, and the Code de déontologie des podiatres that assesses and treats foot diseases limited to the ankle. So a podiatrist can treat all aspects as long as it's limited to the foot and not a systematic problem that falls like within the scope of practice of an MD. So it's like the equivalent of a dentist for your teeth or an optometrist for your eyes. So the podiatrist can diagnose, treat using different modalities. He can prescribe medication like oral antibiotics, for example. He can prescribe lab exams. He can take and read x-rays as well as ultrasounds like musculoskeletal ultrasounds. He can also prescribe foot orthotics and special shoes and can perform injections. So podiatrist mainly practices in private clinics in Quebec, in contrary to the US where they're also in hospitals and because they have a surgical residency to complete. So why did I choose this profession? So it's because of the great variability of practice. So daily clinical practice is not redundant. We have like very diverse cases, such as biomechanical problems, dermatological pathologies for nails and skin, foot traumatology cases, minor surgeries, and foot disorders from systematic diseases like diabetes, for example, and also x-rays and ultrasound permits. So, and there's also an entrepreneurial aspect in podiatry, since you can open your own clinic. And also, since it's a private practice, the hours are flexible and like you don't have to do night shifts, and it's easier to reconcile between personal and professional life. So these were like the main reasons that motivated my choice. So if we speak about the program, course, and classes, so it's a 4-year program with 10 semesters, 2 being in the summer, and 195 credits total, so approximately 20 credits per semester. So in first year, it's more general classes like human anatomy, physiology, histology, biochemistry, all those classes. And the first year also for the anatomy class, it's an 8-hour per week class with cadaver dissection lab. So it's really interesting. Then in second year, it's more specialized in the podiatry field. So we have classes like pathomechanics, clinical abilities, medical imagery, podiatric surgery, etc. And we also have another anatomy, but that focuses only on the lower limb, also with dissection. Then in the summer, following our second year, it's the beginning of the third year, with clinical practice in the university's clinic. So we have classes in the afternoon and the clinic in the morning. The classes that we have are dermatology or social conception, for example. And after that, then for the last year, it's different. We have like 3 rotations. So the order depends on like all the cohorts is separated in 3 groups. So we have different rotations. For me, it was the first one was a hospital internship at the Joliette Hospital for wound care. Then an internship in surgical private clinic. And then for the second semester, it's 3 internships in private podiatric clinics. And finally, it's at the university clinic where we supervise the younger cohort in the morning and see patients in the afternoon. So next Yes, thank you. No, actually, you can go back. That's my next one. I forgot to say something. So there's an option also to go 2 months in the New York College of Podiatric Medicine as one of the internships, and also do many humanitarian trips like in Morocco or Vietnam. But unfortunately, because of COVID, we couldn't do that. But usually the other years they can do it. So in total, we have 4,083 hours of theory and practice altogether. So for the admission info, first, there's a pre-selection according to academic records. So I checked, and now the minimal R score is above 32 required. Then there are 100 candidates that are called for interview, and 25 are accepted based 100% on the interview. There is no CASPER test required before, and also it's a classic style interview. It's not a multiple mini interview or MMI. So for the typical day schedule, I can't really give like a typical day schedule because it varies a lot, but I'm gonna give like a variety of cases. So appointments can go between 15 to 45 minutes depending on the case. And some examples are like an ultrasound guided cortisone injection for plantar fasciitis, a taping for tendonitis, a diabetic foot wound care, a wart treatment, a biomechanical exam for orthotics prescription, etc. Also, some clinics have assistants and nurses in their team. And yeah, there's not a typical kind of patient in podiatry. Like it's really varied, and we have as much adult, pediatric, and geriatric patients. Some podiatrists tend to have a more certain type of patients depending on their interest. Like for example, an athletic, more athletic patients or diabetic patients, etc. So next slide. So for the profession of podiatrist is in short supply right now. So this should continue for several years. So usually we don't have difficulty establishing a professional practice in either a region of Quebec. And the working conditions are and remuneration are generally considered to be favorable among the health professions. In fact, some fourth-year students already have job contracts when they graduate, and the demand is high. There are no more than 25 graduates each year. Then after graduating, there are multiple possibilities. So you can work in an established clinic or in multiple clinics. You can open your own clinic. You can go also complete a surgical residency in the US. Unfortunately, we can't do that here, so you really have to go complete it in the US, but you can come back and practice here with it in a private clinic. You can complete a master's degree to become a teacher, so you only need a master's to be a teacher in podiatry. And you can go also in research. So here are a list of relevant sources with additional information. And thank you for your attention. Do you have any questions?
Thank you, Mahua. So let me see in the chat. There's no question for now, but I'm sure the question will be popping out afterwards. So I have a question. Do you feel, because I know that you did some internship before COVID and some internship now during COVID, did you notice a big difference before and like now?
Well, actually, like I did more shadowing before COVID. It wasn't really an internship where I was the one practicing. That I started that during COVID more. So like, of course, the big difference, like everyone, like the mask and the protections and everything, but I didn't feel like there was a big difference since it's more in private clinics. So the difference wasn't enormous.
Okay.
Like I didn't feel like something really considerably changed.
Okay, so we do have some questions in the chat right now. So
okay.
Damos, how much does podiatry and an orthopediatric overlap?
Or so what? I'm just going to read it just to make sure. In the chat?
Yeah.
Okay. So do you mean like orthopedics after MD, after medicine?
Yeah, I think it's the podiatry with the ortho medicine. Okay. What is the overlap?
Okay. So actually, yeah, for podiatrist, you can't do big surgeries like an orthopedic, only if you go complete your surgical residency in the US. So if you can, well, the podiatrist is only limited to the foot and ankle, but the orthopedics can like everywhere in the body. They can like the arms, the knee, the whole legs, but the podiatrist is limited to the foot and ankle. I don't know if that answers your question.
If it not, I think he will re-ask the question in the chat. So there's another question. Is the university the only university in Canada having this major?
Yes, so actually it's the only university in Canada that has it. The other one, or else it's in the US. So in Canada, it's only at the UQTR in Trois-Rivières.
Okay, and then there's another question. The person asking, I imagine this will vary, but what are the startup costs for a private clinic?
The startup costs, if you want to open your own clinic?
Is that what you mean, Adamo? I think he's
Yep, exactly.
Okay. Oh, hi.
Hi.
Well, actually, I don't really know what are the costs if you want to open your own clinic, since I'm still not done and it's not like in my immediate project for now. So I can't really answer. Sorry.
Mahua, did you mention how easy it was to find a job? I think you did, right?
Yes, yes.
Okay,
yeah.
Is it you to apply, or it's the clinics or the hospital that comes to you guys to offer you guys a job? How does it work?
Okay, so since you have 3 internships in private clinics in your first year, that you choose which clinics, usually people after that, they sign contracts for to start working the year after that. And we also have a group, a Facebook group with all the podiatrists. And because we're not a lot, like I think it's 300, maybe a little less. So they have job offers coming really frequently. And yeah, so there's really not like a difficulty to find a job afterwards. There's a lot of demand because there's more job to do than podiatrists that do it.
Okay, another question in the chat. Can you do or lead any research as podiatrist?
Yeah, well, now there's some research mainly on the diabetic foot wound care and biomechanical problems. There are not a lot of like research team on podiatry. They like, since we are not a lot and it's only one program in Canada. So yeah, there's not a lot of research here, but there is some research and it's possible to get implicated in that and do research, yeah.
Okay, there's another question. What attracted you to study podiatry, or like what introduced you to podiatry?
Yeah, well, what I liked about it, like I explained before, it's that it's really versatile. There's different cases, different things you can do, and all related to the foot. Also that it's not really redundant, but what it initially I didn't like within those. I usually like I knew I wanted to go in healthcare, but I wasn't like sure 100%, and I didn't know actually podiatry. And then I went to see to do an observation day at a podiatrist, and I really liked her practice. So then I applied, and it worked out.
Good for you. then I have another question. The chat is coming up. Then I have some question. Is there further training to be more specialized at, well, you mentioned the surgery possibility in the US. Is there more to like in Quebec, maybe like specialize in pediatric or like specialize in, is there any specialization?
Well, there are like formations, I'm not sure how to say it in English, but des formations that are available, but you cannot really be specialized in something. You're always considered podiatrist equal to the other podiatrist unless you did the surgical residency. But you can choose to have a certain type of station. So you go to the other like formation, and you have more knowledge in that. So you build your clientele with that.
Okay.
So it's not really, it's only the surgical aspect that you can add a residency to. You can't have another type of residency.
Okay, I see.
You could do like a micro program or something in like wound care or something like that. But you have like to work your way to find those kind of things.
Do you have any interesting case that you can share with us?
Interesting case. I have to think. Well, now I have a lot of wound care treatments. It was yesterday. It's not that's the one that I'm thinking about, but we had a really big one. I don't think I can show pictures because it's confidential.
Yeah,
and I didn't ask permission, so I can't. But it was like a really big wound. We could see the bone underneath, and it was like we had to debride it. And
that's the English word.
Yeah, okay. And irrigated, debrided. So then for the pansement, I'm not sure the term. And like we learn more in practice than in theory, I think, because we're exposed to different things. And like the practice in Quebec, we're in clinical, like in private clinics, but we have one of our internships in a hospital. So it's really different than what we usually see. It's not the same, it's really not the same thing. So we see like more intense cases in the hospital than what we see in private clinics.
Okay. So there's 3 minutes left. If anyone wants to ask a question, please seize your moment. Otherwise, how challenging is the study? Like the whole study years, how challenging do you find it is?
Yeah, well, it's really demanding because you have a lot of credits per semester, and there's a lot of like we have a lot of classes at the same time with a lot of matière in it, a lot of
theory classes.
Yeah, so like and it's all by heart, so you really have to study constantly. And also we have like an exam at the end, so I have it in a few months, and I have like you have to remember everything you learned from first year, so you really have to be like up to date and really study. So it's challenging, but it's after the first year you get used to it and it's okay. But the harder is the first year for me. That's what I found.
Sure. Aaron, the question is, he missed the name of the university.
Yes, so it's UQTR or Université du Québec à Trois-Rivières.
Thank you. Any more questions? So one last one maybe. In your program, is there a lot of students from CEGEP, or many have already a university degree?
Yeah, that's one of the things, is that when I got admitted, it was approximately half and half. And it's really like the ones from university found it really easier since they could credit some of the classes. They didn't have to do them, so they had more time for the hardest ones. But now they take a little bit more university students, but it depends like how the interview goes. It depends on on your grade also before for the pre-selection. But when it was my year of admission, it was half-half.
So thank you, Mahua. Thank you very much for the presentation. So the next one presenting will be our acupuncturist. So please welcome Justin. Hello, Justin. You can unmute yourself and show your video. Are you there, Justin?
I'm there.
Oh, hi, Justin. Hi.
Sorry,
I will let you present.
Yep. Hi, everyone. My name is Justin Pham. I'm an acupuncturist. Okay. So my parcours, at first, after high school, I studied administration at the Cégep Montmorency. After administration, I tried university in math, but it didn't really work out well for me. So I went into acupuncture. The way I did it, the program where I learned is at Collège de Rosemont. Okay. It's in French though. Okay. If you want to study in English, I think you have to go as far as like Toronto, but Toronto is a little bit more expensive. Here, it's a technique. So they teach you in 3 years. This being said, a lot of people, they do it in 4 years because it's a very demanding program. It's very hard. Okay. I've been working since 3.5 years now. Okay. So I'm sorry, you can move on with the PowerPoint whenever you feel like it, because I don't see it. So I'll let you manage that. All right. So it's been 3.5 years, guys. So so a day in a life. So how does acupuncture works first? I'm going to explain to you a little bit. So acupuncture works with meridian. Okay. So meridian, it's like a highway of energy. Okay. So what they teach you in acupuncture courses is that the qi, okay, which is the energy, is contained in your blood, the shui. Okay. So you have different lines on your body. Okay. Different like highway of energy, I would call it as such. Okay. And on the highway, you have different points. Okay. And all those points have a meaning. Okay. So let's say in your body, maybe you guys don't know yet, but you have points for stress. So if I put a needle, after a minute or two, you feel like immediately like more relaxed. You have points for headaches. You have points for foot pain, shoulder pain, a lot of different points in your body. You do a lot of stuff actually. Okay. So what do you learn in acupuncture? You learn how to puncture certain points, because it's not like all points that gets punctured the same way. The angle of how you puncture, because let's say if you puncture a point on the stomach, or let's say digestive problems, well, you can't go 9 degrees this way because you're gonna pierce through the intestine. Or here, you gotta go on an angle because you have your lungs, you know. So so that's one thing that you learn. Another thing that you learn is how to do cupping. I'm gonna show you guys too. In fact, I'm gonna show you guys what I do at my clinic. Okay, guys. So you have cupping. You have the small size, you have the bigger size. Okay, so how cupping works is first you put baby oil, okay, on the body. You press as such, and it's gonna bring a suction up. Okay, so when it brings a suction up, you massage, you rub, it feels good. Okay, this is what I like to do at first. I'm explaining to you guys why, because a lot of time what people don't know is that you can get bruises that are stuck like underneath. So when you see all those cupping marks, let's say Michael Phelps, we did at the last Olympics, the swimmer guy, a lot of athletes, they have those cupping marks on their body. If the mark is purple, okay, purple, black, brownish, it meant that they had a bruise stuck underneath. So when you have a bruise stuck underneath, guys, the blood cannot flow properly. Okay, so you have a bruise stuck underneath, the blood circulation is blocked. So with the cupping, with the suction out, you bring the blood up, and the blood can flow, because all the good stuff in your body is contained in your blood. It's the blood that's nourishing every organs, the brain, the muscles, the heart, etc. So you want to have a good flow, a good circulation in your body. That's what acupuncture does. Let's say, I don't know, you have you have a headache, okay? You have a headache. Us, what we believe is that because your energy is blocked, let's say here, you have a headache at your temple, or your energy is blocked here, okay? And of course, the energy do exist. It doesn't mean that you don't see it, that it doesn't exist. It's like the oxygen, right? You don't see it, but without we'll all be dead. So you put the needle there, you manipulate a little bit, and then the chi flows, and you have no more headaches. What people like to use, what we learned too in school is the, I don't know how to say in English, unfortunately, pardon my language, it's the Moxibustion. It's kind of little herb that you heat up. It's very good for when you get like a cold, digestive problems maybe. It's kind of weird because it smells exactly like pot. You know, I don't smoke, but I think we all know the smell. It smells like pot. It smells a lot and it creates a lot of smoke. So if you want to use that herb, make sure that you have a good fan, or you have something, or you open the window. You know, what else do we learn? We learn about the Electro Stimulations. I know a lot of like healthcare specialists, they use what we call like in the physio, like the TENS. A TENS is like a machine, okay, that vibrates a little bit. So us, how we do is that we put it on the needles. So it shakes like this. So more signal, meaning more blood there. Okay, so it promotes like faster healing, I would say. Okay. So me, a day in a life, what do I do is that I work at 2 clinics. Okay. I work at two clinics that specialize with CSST and SAC patients. So CSST is people who gets injured at work. So let's say you're at work, I don't know, you're a cook, whatever, and you trip and you fall down. So you declare to your boss, you declare to your doctor. Okay, he gives you like a sick leave or whatever, so you don't go work anymore, and then you get referred to a clinic that's taking care of you. So CSST patients, it's very cool because compared to private, I would say they don't pay for the treatments. So they come see you as many times a week as you want. So let's say at one of my clinic, I'm there 3 times a week. Well, that guy comes see me 3 times a week, and you only do his pain. You only do his pain. So let's say he injured his shoulder. Well, you only focus on the shoulder until he heals. So it's good because you get a lot of patients. You get a lot of patients in a short period of time. So you can train a lot. So that's what my teacher used to tell me at school. So if you get hired in a CSS patient, the good point is you practice a lot. Practice a lot because it's all pain cases. Same with SAC. Car accident, motorcycle accident. It's all like neck pain, back pain, migraines. So you treat the cause, you know. So after a day, you can do quite a lot of patients because you only focus on the cause, like I said, and you already know those patients. So you don't have to ask. I'm sorry.
Anybody no, it's okay. No, it's okay. It's just the person unmuted himself by accident.
Okay,
you can continue.
Okay, that's fine. That's fine. So compared to like private patients, you have to obviously you have to sit down with them. You have to ask them a lot of questions, blah 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 blah, and then it takes more time, you know. So that's why I chose to go with CSSC SAC at first, because you question the pain, you treat the pain, and then that's that. You know, it's very simple. You see a lot of people and you get experience rather quickly, you know. My stress level would be maybe 0 because I'm not a really stressed person. I'm confident in my abilities because I've trained a lot, you know. So I would say acupuncturist, it's not a very stressful job, I would say. A lot of acupuncturists, they're very zen. You know, what people would see too if they go in a clinic. It's very relaxed. It's very zen. There's music. A lot of patients actually, a lot like maybe 8 out of 10, they all fall asleep. They all fall asleep during the treatment. But that's good. It's when you rest and when you sleep that your body heals. You know what I'm saying? So it's a very good thing. The best aspect of my job would be that it's very useful. You know, it's very useful. I don't need to stay with you for 30 minutes. Well, I do. I do in a way, but I'm not like massaging you for 30 minutes. Even when I do cupping, I like to do cupping for maybe like 15, 20 minutes at first to bring out all the bad blood. And after that, we do the needles. So you can just rest. You know, I can help a lot of people at the same time. that is good too, money-wise, you know, that's one of my advantage. It's good there. What's that? Oh, okay. That wasn't me. So what was I saying? Yeah, so the best aspect of my life, the best aspect of my profession, I would say it's very useful in a way where a lot of people, they think of acupuncturists as like magicians, you know, because there's a certain technique, you got to see it to believe it. Where let's say, it's called the Dr. Tan technique, balancing methods, okay? Where let's say the guy has a lower back pain, right? And then you put needles in his hand or in his arms. You do that when like the area is too like, it's too painful. You can't really touch. You put like needles in his arm and the pain goes down 50%, you know? Or in one of my class, one of my colleagues had a blocked nose, and the teacher, I don't know how she done it, but she put like 2-3 needles next to the big toe, and immediately nose went unblocked, you know? So we're like dark magicians, you know? So that's one of the best aspects of my job, I would say. It's very useful too. You take care of people. It's pretty simple, you know, when you see like, I don't know, 30 like shoulder pains a week or whatever. And if daddy has a shoulder pain, well, it's easy, you know, you do it for daddy, or you do it for your mom, you know, or allergies, even good for that too. So the worst aspect, I would say, maybe doing notes at the end, maybe notes. You know, I don't think a lot of healthcare specialists likes to do notes. But then again, my notes are pretty simple because like I said, with CSSC, it's always the same thing. And sometimes I write the pinyin name in Chinese. So even if I get inspected, nobody will understand. No, just kidding. So I think my notes, unfortunately, sometimes I have to deal with racism too. Sometimes, like maybe once a year, you know, because we're Asian, I'm Asian, whatever, and they think they could call it like chinoiserie or whatever, you know, whatever. I'm not gonna say what they say, but it's very rare. A lot of people, when they go to your office, guys, they want your help, right? They're willing to try stuff and they want your help. So yeah, easiness of finding a job. Me, I was very lucky. Okay, I had my great friend Francis Chung. He the second that he learned that I graduated, he wanted to quit his clinic, so he kind of like referred me in. So I'm very happy, you know. But I don't think it's that hard to find a job because a lot of clinics, they're looking for acupuncturists, you know. For some reasons, it's hard to find an acupuncturist. I don't know if it makes sense, but all my colleagues, nobody had a problem finding jobs. I don't know, as of now, maybe it's because of the COVID, probably, in fact. A lot of clinics are looking for acupuncturists, but none of my colleagues, they got any problems finding a job. So that is, I wouldn't be too concerned about that. Why did I choose this profession? Well, I do Chinese martial art. I do Kung Fu. I do Bai He Chuan. So Korean Kung Fu. And my dad brought me to the Kung Fu school when I was a little boy. And back then, if you were a sifu, a shifu, you had knowledge in Chinese medicine too. It wasn't just about the martial art. So I want to be like an old school guy, you know? So later on, if I can open up a clinic with my own martial arts school, then I'll be happy, you know? So, you know what, guys? Do we still have time? We still have time a bit? I want to do it, you know, just because I know somebody's going to ask me if needles hurts. The truth is, they don't hurt. It's like a mosquito bite. You're better going to feel it. I'm going to show you guys on myself. Okay, guys? I'm going to explain to you guys how come it doesn't hurt, okay? Obviously, some area in the body, like underneath the feet, you know, some hidden areas, a little bit more sensitive. They're hidden for a reason because they're more sensitive. So people that come see me for fasciite plantaire, you know, sorry, I don't know the term in English. It's like when you have a pain on the foot, it's like heel pain. Well, that spot is very sensitive, or on the hand right here, you know? So yeah, I'm gonna show you guys. So guys, how it works with needles, okay? First, you disinfect the part. I'm gonna do it on my arm so you guys can see, okay? So you disinfect first, okay? With me, since I'm a clean dude, I'm not gonna do it, but don't do what I do what I say. All right, guys? So why it doesn't hurt, guys? Because a lot of acupuncturists, okay, how we learn in school is you have this in French is called un mandrin. It's a plastic tube. So with this stuff, you aim at the point. You aim at the point right here. So you guys see, you aim at the point and you go, oh, and it's in. And then you go, and it's in. That's it. Since the needle goes in one shot, the patient doesn't feel a thing. He literally doesn't feel a thing. I didn't feel nothing, in fact. So with this thing, it's a lot better. Now, I know a lot of people, okay, especially people from China, you know, they just take the needle and they go pop, 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 and it's super painful, you know. So they have their own ways of doing things, okay. But here in Montreal, they teach you with the plastic to put them on there. So it's good, guys. So it doesn't hurt at all, okay. So for those who thought like maybe it's gonna pinch a bit, don't worry. A lot of patients, like I said, they all sleep during the treatments. So that's that, you know. Any questions, guys?
So
questions?
Yes, we actually have some questions.
Yes.
It is to become acupuncturist. Is
Yes.
there any preparation that they need to do? Is there any specific study they need to do?
Guys, I suggest go through all your like basic courses from CJEP at first, okay, guys? Because if not, when you start acupuncture, you're gonna die. You know, you're gonna have like 10 classes every semester. It's not cool, you know, because a lot of the classes, first you have to learn like anatomy, what muscles where, you know, where are the organs, this and that. After that, you learn the points. You gotta learn the Chinese name too. You gotta learn how to puncture it, how to manipulate the needles for each point. You know, because a point for pain, you don't manipulate the same as a point for fatigue, you know. I can explain to you briefly. A point for pain, you want to turn the needle 6 times clockwise because that makes the chi go away. If let's say a point for fatigue, which can be some points in your legs and back, you want to turn it on the other way, the other side, 9 times. It's to bring the chi there, okay? It's to help with fatigue, let's say. When you put the needle, okay, if you see that there's like a round circle around the needle, it means that the chi went there. So it's good. It means that the point where you can remove it. But I suggest you do like all the basic courses first. It's going to be easier, you know. And I think you need your mats. Yes, you could practice. You can do it outside of Quebec too. It's not a problem. Here we have an order, okay, that protects us and that are making sure that we're doing our job properly. But yes, you can practice out of Quebec too. Sorry, somebody just asked.
Yeah.
But yeah.
Another question, how about, do you have any immigrants in your classes when you did your school? Because
it's funny.
some Asian, like from China, they are acupuncturists in China and they come here and they still want to be acupuncturists. Do you have this type of classmates?
No, to be honest, it was funny to me because I expected a lot of Chinese, I expected a lot of Asians, but they were like mostly all whites, all white people. I had like me and one of my colleagues, a female, that were Asians. I said, well, all white people, you know? So yeah, all white people. But the Chinese acupuncture, the Chinese acupuncturists from China, when they come here, I think they're like the program, it's approved. You know, they're certainly better than us here, to be honest with you guys, what I've seen. So it's approved. You can start working immediately. That's what my acupuncturist is doing. She was from China. She came here and then was approved. So she just started work.
That's very practical. Another question, is there any puncture errors when you try and learn, and how is it dealt?
Oh, yeah. So guys, when you train in stage, okay, keep in mind, first you have like little dummies that you train, okay? Or you train on pillows, right? But a lot of the time, before you do it on at the clinic école, when you have like real patients that come for the last year, so you train on your colleagues, eh? So sometimes, let's say you train for shoulder pain, you know, and then your friend trains on you, and sometimes, yes, you know, he can go a little bit like roughly. He can go a little bit like roughly with his puncture. So of course it hurts. You know, we gotta train on ourselves. Keep in mind, we don't have the problem for real. We don't have the disease for real. So our body doesn't need the needles. So of course, maybe sometimes, you know, your body rejects it, or when you, especially at the 3rd semesters, when you start puncturing, a lot of people do mistakes. You know, you're not supposed to puncture on the vein. Let's say there's an acupuncture point that goes right here, and there's a vein here, where you go a little bit beside. You know, you want to avoid the vein. So that happens. Okay, that happens, but mostly in school. You know, you gotta be confident in yourself. You gotta be confident in your capabilities. When you graduated, even though it's only 3 years or 4 max, depending on how many years you want to put in, you're good. You're good to work. you know, like you know your stuff. We cover a lot of subjects, you know, you know your stuff.
Good. Then Kathleen's question: do you work another job while working as an acupuncturist in 2 clinics?
Not at all. Not at all. But back then I used to help my dad's restaurant, but that was only for fun. Acupuncture, you can make a living. You can make a living like easily, you know, guys. So let's say, because the one of the main perks with acupuncture is that you could see multiple people at the same time. Mm-hmm. So me, if I have, in a day, I could have like 30, 32, 33 like CSST, but I know them all, you know, so they just come. And then how long does it take me to put needles in your shoulder? Maybe, especially we know each other, you know, takes what, 30 seconds, a minute? I can see somebody else, and I let you rest. I'll call me if there's anything, you know, if there's any needle that's bothering you, you call me, you know, and I'll come and I'll go see somebody else. And every time like this, you get a certain amount of money depending on what you deal with the clinic. Me, I got a good deal, you know, guys. So if you decide to follow this job, you know, a lot of people, they get like the 60-40% deal, where like you keep 60% and you give 40%, you know. And if you do it properly, you can maybe get 30-70, you know, which is my case right now. So you make a good living, especially if you see like multiple patients every hour, you know. Of course, if I get a new patient, I have to block my schedule 30 minutes because I want to sit down with you, understand how your pain is and blah, 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 blah. But once you know everybody, then it's simple, you know. So you don't need to work another job, as far as I'm concerned, for me, you know.
So thank you, Justin. I think the time is up. Thank you very much for your presentation, and thank you for your time. So the next one presenting will be nursing, and that will be me. So I will just, for the presentation of nursing, since I have a lot of things to cover, so I will try to go as quickly as possible. And so let's start. So I will present myself again. My name is Willin. I am a registered nurse at the General Jewish Hospital in ICU. I studied at Jean de Brébeuf College in the Health Science program for 2 years. And then I went to University of Montreal for 3 years of bachelor. So I didn't do the CJEP path. I just directly went to University of Montreal. Then as soon as I finished my bachelor, I had different job offers at the Gland side, the Super Hospital, Montreal Cardiology Institute, and General Jewish Hospital. I chose General Jewish Hospital because it's closer to my house. Then on that, I stayed at a surgical unit from June 2020 until March this year for 9 months. But actually, when I first started, it was a COVID unit. So I started off in a COVID unit for 3 months. Then I transitioned to a cardiovascular and abdominal surgery unit. And after that, I seized my opportunity when I saw the ICU units position were open. So I went directly to ICU. So I work in ICU from March until now. I'll just mention briefly different pathway to nursing. There's 3 types of nursing. So one is LPN, so licensed practical nursing. It's a diploma. So you can get this within 12, I think it's like 9 months of study, but it's not a complete nursing. You need a nurse, official nurse, to supervise an LPN at work. And they are really quite limited in the advancement opportunity of the career. And then registered nurse, so it's the official nurse. We have 2 types. One is graduate from the bachelor's, so BSN, and one is from the CJEP, so it's the ASN. For more information, you guys can go to Avenir en Santé. That over there, they explain quite more in detail. Next slide, please. So what does a nurse do? I think everyone has a slight idea of what does a nurse do, but a nurse can also be a researcher, a teacher, and a politician. We can work in army, school, cruise ship, yes, like those luxuries one. We can work in summer camp. We can work in isolated village in the north. We can work as a private caregiver for elderly and children with special needs. We can also work in specialized clinic like aesthetic clinic to do Botox, or fertility clinic for like IVF. So what does a nurse do? Nursing have a irreplaceable nursing expertise, and we do a lot of things in different field. I will explain you guys a bit more in detail in the next slide, not quite yet. We really do more than just give out pills. Then there's also super nurses and nurse practitioners. Then you need to do a master in order to be able as a you need to do a master to be able to be a nurse practitioner. And once you're a nurse practitioner, you can follow your own patient. You can open a clinic in like outside of Quebec, because in Quebec, we cannot open our own clinic. And then you can give prescriptions, you can do follow-ups. There's a lot more things that you can do. You're like a semi-doctor type of position. And then on the next slide, just trigger warning for blood. And yeah, so next slide, please. So this is what the ICU looks like. This is like the picture on the bottom that you guys can see. That's a COVID patient. Obviously, the picture, I found it online because I am not allowed to take pictures from ICU. But you see all the pumps, all the machine, all the patient that's in the bed. This is not the doctor who are doing it. It's the nurses who are doing it. We are adjusting the medication via the pumps. We're making sure that the patient breathes. We are monitoring patient's blood pressure, heart rate, heart monitoring, arrhythmia, everything is the nurses who are doing. We're also counting how much urine output you are putting per hour. And all of that we assemble and we do a nursing assessment. And depending on the assessment that we do, we will call the doctor as if it's an emergency, or sometimes more minor thing that we can do it more, we can hold a bit during the rounds. Then next slide. You can also Google it. Some interesting cases that I see in ICU, like the continuous renal replacement therapy. That's one of the big machines that you saw in the earlier pictures. That's like do dialysis, like near the bedside. That's one ICU specialty. One ECMO is extracorporeal membrane oxygenation. That's for very, very, very sick patients, and some COVID patient needs it also. It's basically we replace your lung with the machine, and it's also nurses along with another professional that are taking care of like those sick patients. It's rare that doctors will play with the machine. Usually they give out orders, and it's the nurses who execute them. For some more interesting surgery, because we have some complicated surgery also during ICU, you can go to see abdominal vac. That's basically a vacuum that we put on your open abdomen, because the surgeons are not able to close up your abdomen. In the previous slide, please. Yeah, and a HIPAC, it's a very interesting thing for oncology patients. So we put chemotherapy in your abdomen and we shake you up. Then we also deal with some necrotic foot patients, and that's disgusting pictures that I will not show you guys. And next one. So my schedules, our nursing schedule depends on a lot of things. So it depends on your environment. If you are in hospital, you're in unit, you are in clinic. It depends on the shift. Sometimes you do only, some hospital, basically the French, you only do day shifts. So you only work during the day, or you only work during the evening, or only during the night. Evening shift is from 3 p.m. to 11 p.m. And then night shift is from 11 p.m. to 7 a.m. And some hospital you do only 8 hours. Some hospitals offer also 12 hours. And depending on your position, if you're a nurse, if you're a nurse in charge, head nurse or nurse educator, the hours depends and varies a lot. Me, I'm just a nurse. I'm working in ICU where I do 12-hour shifts and I do rotation, so day and night. So in the little table that you see, it is my schedule for August, September. So as you can see, I'm working full-time. So basically 80 hours per 2 weeks. So in order to complete my full-time shift, I need to do 6 days of 12 hours and then 1 day of 8 hours. So if you guys count, on the 29th is 1, then 1 on the 1st of September, 2nd of September, the Z is the 12-hour night shift, and then 6 6 is actually 8 hours night shift, 7, 10, 11. That's 12 hours with 8 hours. That completes my 80 hours per 2 weeks. And I need to work 1 weekend on 2. So as you guys can see, on the 29th is a Sunday, I worked. Then 4 and 5 September, I didn't work. 11 and 12, I work again. So that is how the schedule is for me at General George Hospital. If you work at Saint Justine, it's another story. If you work at the Glen, it's another story also. So it depends really on your hospital. And for vacations, I don't have a lot of freedom to choose my vacations, unlike many other professionals. I need to do requests, and sometimes my request will get declined, and I will just have a random vacation that the hospital give me. Because hospitals is not like the clinics. When you close, you close. Hospital, especially ICU, needs to be run 24 hours, and depending on, no matter of the holidays, or no matter if you're having a wedding to attend, the hospital still runs. So we still need people. So sometimes it's not you request and you will have it. They really depend on the need of the ICU for the schedules. Next slide, please. So example of 12-hour shift. I arrive at 7:20 at hospital. Since I live quite close, I need to leave the house around 6:50 if I'm driving, and 6:30 if I am taking the transport. And then from 7:30 to 7:45, I take reports. Sometimes reports can be longer than that if the patient is really, really sick. And then from 7:45 to 8, doing preparation. So I'm verifying the prescription, setting up the working schedule of the day, what type of medication I have to give at what time. Do I have blood tests to do? Do I have other exams that I need to run and other procedures booked for this patient? I need to know them and prepare my schedule accordingly. And then I need to prepare the medication. From 8 to 9, I do my first assessment. So head to toe, is the patient breathing? How is his breathing? Is it normal? Is it abnormal? Is it regular, irregular? How is heart rate? All the line, are they all good? Like all you guys see, like the pump, sometimes we can have 12 pumps in the patient's room. And if it's that, I need to make sure that all the medication are running, that if one medication is running out, I need to prepare extra bag. And sometimes I need to change the lines because the lines is being there for like 4 days. So there's a lot of things to check. I need to also make sure that the pump on what's written on the pump is what is according to the prescription, and the bag hanging on the pump is the right medication bag. And then I need to also check for the security and emergency material and meds, because sometimes if the patient crashes, it crashes like this, and you need to have all your emergency meds at your bedside. You have no time to run in the unit to get your medication. And then from 9 to 3:30, it's a day shift routine. So first you will run with the ICU team, you will update nursing care plan. So after you do your first assessment, you need to have a list of things that you need to bring up to the doctor. You want to discuss with them, or like the dietitian or occupational therapist or physiotherapist that you want to deal. You want to resolve the problem during your day. And then you need to follow up with other specialty, like I said, social worker, physiotherapist, nutritionist, wound care. You need to do constant nursing assessment because you have a constant monitor in front of your computer. So you need to keep an eye always on that. You need to also update your family. And during the 9 to 3:30, you will have 30 minutes coffee break and 1 hour of lunch break. But sometimes you don't have the time to take your breaks. It happens to me twice, I think. Then from 3:30 to 6:30 is the evening shift routine. It's more slow because there's less professional. And then approximately the same as the day shift routine. And then during that time, you will also have a 30-minute supper break. And I didn't finish, go back. From 6:30 to 7:30, you need to finalize your care, verify all the pump, prepare extra heavy bag if needed. And then you need to write your report. Sometimes it's like this long, and sometimes it can be 2 pages. And then you need to update your nursing care plan. And from then, from 7:30 to 7:45, you give your report. And then next slide. So pros and cons. Pros is very, very, very easy to find a job. The 3 hospitals, I did a basic interview and they gave me the job offer. It is possible to work in other provinces, even Quebec. We are like French. What I was saying, yeah, we are recognizing other provinces. You don't need to pass other exam. It is also possible to go working in USA, Australia, UK, but in that case, you need to pass another exam in order to be recognized. You can change also working environment really easily, like the specialties. Like when I went from surgical to ICU, it's just direct transition. I don't need to pass by other exam, other interviews. I don't need none of that. And if I'm sick of ICU, I can go to orthopedic, I can go to palliative care, I can go to pediatrics. All these specialties I'm allowed to go without passing, like doing other special formations. Of course, within the unit, you will have more courses, theory classes to pass in order to feel comfortable working in that specialty, but it's generally very easy to go. Like me, when I went transition from surgical to ICU, I did 2 months of a mix of theory classes and orientation at bedside, and that went really well, smoothly. I had a lot of support. It's a very stable job. You have plenty of opportunity for advancement. So once you become nurse, you can go for head nurse, assistant head nurse. You can also become a teacher. If you want to go higher up, there's masters you can do. You can go even higher up in the management in the hospital. You can fight for nursing recognition as a nursing politician. There's a lot of possibilities to nursing. You also it's very easy to get ready in the morning because you are basically wearing the same thing every day. So no hassles in the morning, variety in daily work. So like I said, depending on the type of patient that you have, some can be really, really demanding, and it's quite exciting for me actually. And sometimes the patient is more stable, so you have a more slow day and just enjoy your slow day because there's not much of slow day in ICU. And high earning potentials. So if you guys don't know, we are having a lot of bonuses from the government, and the cash flow into your bank account is quite important. So you also have a chance to appear on TV. So the picture that you see is from CBC when they come to our unit to film. So I was taking care of a COVID patient in that room. That's why I have the N95 on. Cons, like I said, there's no much control over your schedule. Even sometimes you request for vacation days, it can be declined. And you need to work during holidays. It's not possible to have your holidays off. Like for Christmas or for New Year, you choose one of them. And sometimes if you choose New Year and too much people choose New Year, you will end up getting Christmas afterwards. So it's hospital life, and it can be very stressful and emotionally draining because sometimes you deal with life and death within the hospital, and it can be very, very demanding. Or sometimes you have confused patient who is saying bad words all day to you. That's also very demanding. It demands a lot of self-control to not get very angry to the patient. Some negative experiences, like I said, you can have physical and verbal violences. It happens to me a couple of times that the patient is confused and they're very combative and they will try to kick you in the face and kick you in your head. It happens, but we have medication and we have a team and we restrain them and we try to provide the care as much as we can. And sometimes we will have obligated overtime. It's more in the French hospitals. With me, I only worked 2 16-hour shifts. And to be honest, the second 16-hour shift, the next day I have a 12-hour shift. I wasn't able to finish my 12-hour shift. I ended up vomiting and not feeling very good. So I was sent home. So just to tell you guys that it can be very physically and emotionally demanding. And sometimes you will also live some prejudice against the nurses. Me, I lived with one of my mom's close friend. He's basically said it to my face that nurses, he doesn't understand why I went to nursing, because in his Asian mind, nurses are only there to give out pills, and he feels like I chose a really low profession. But it's actually, we actually do more than that. So that's the cons that I have in mind. So I think next is a question and answer period. I don't know, I don't see the chat. Do you guys have any questions for me? Let me go up. So hi, I would like to know how many patients you take per shift. So on a surgical floor, like I said, General Jewish Hospital is among one of the best hospitals in Montreal. So on a surgical floor, the maximum patient that you can have is 6. But I know that like at Sacré-Cœur, one of my friends, she has 9 to 12 patients. Even if she's paired with an LPN, 9 to 12 patients, that's a lot. In ICU, ours maximum is 2 patients, and 2 patients, they need to be really, really stable. And if you feel like they are unstable, you can unpair them. Our assistant head nurse are very, very understanding. So in ICU is 1 to 2 patients, depending on their physical condition. Hello, is it possible to have the PowerPoint? We will see too. If yes, we're gonna post it on Facebook YAHPA. Among those hospitals, why you choose GJH? So 1, it's really close to my house. 2nd, they have very, very good reputation within Canada. I did my own little research. And then, like I said, they don't force you to do overtime. The 16 hours I did, I accepted on my free will, and I regretted it afterwards, but it's still me who made the decision. Like at Saint-Justin, it's French system, so they will force you to stay. Like the 16 hours, they force you to stay. It's not, do you want to stay? It's, you need to stay. So that's one of the reasons why I choose JGH. Are there any health requirements for becoming a nurse? So there are not like officials, but like if, let's say you have a really pretty bad back pain, or you have really limited mobility issues, it can be kind of a ick if you want to work with like heavy patients, especially in ICU and in nursing in general, actually at the bedside, because as we know, like obese patients also often have more chances of getting sick. So a lot of my patients, they are twice my weight. So sometimes position them, or when they get really violent because they're confused, it can be physically really demanding, and it can hurt your back. If you have a back pain, even more, or you have a shoulder pain, it can be quite demanding. And if you're immunosuppressed, it can happen, like if you have lupus, that can limit the type of clientele that you can have. So yes, so there's still some health requirement, but it's not on black and white. It really depends on how you feel, and you will have to pass health exam before that. But me, since I'm healthy, I didn't pass the health exam. Then let me see, what encouraged you to choose nursing? So what encouraged me to choose nursing was actually my parents. And they were talking, we were pretty straightforward in the family. So they were talking to me how easy and how stable nursing job is. And I really realized that with the pandemic, when everyone was staying at home or being laid off, well, I'm receiving extra bonuses of being full-time and working night shift and evening shift for being a nurse. So I'm really grateful that I choose nursing as a profession, so I can have a really stable job. Can you talk a bit more about nursing practitioner? Actually, I think it would be better if you do your own research online, since I know as much as the internet, I know as much as you know, because what I know is also from the internet search, but I'm having planned to do my master and do my nurse practitioner masters. But before that, I need 3,600 hours of clinical experience. So I'm still earning that. One thing that pushed me to do the nursing practitioner is that I will have more stable hours. I will no longer need to do working the night shift or the evening shift, and I will have more autonomy, a bit more responsibility, and I will have my own patients to do the follow-up. So that is something that I'm really looking forward to it. Then hi Willing, what makes you interested in working the ICU compared to the other units? So ICU, one is when I did my internship in ICU, the fact that I'm following one specific patient, it's what attracted me the most. And I have really good grades when I did my in ICU theory classes. And honestly, I am a person who like to have the adrenaline rush. I want to feel like I'm occupied. So sometimes in the like surgical units, I don't know my patient to like the most specific points, but with ICU patient, I know from head to toes. I know who they have as a family members. I know what they do. I know their social situation. I know their past medical history. I know like the back of my hand. That's basically it. And so that's something that I like. I like to feel more in control of my environment, because sometimes on surgical unit, the surgeon asks me this, and I'm like, to be honest with you, I don't know. So in ICU, I learned to learn my patient from really in depth, and that's what I like the most. And also ICU salary and pays really well. So that's something really good too. And then I have one more minute. So hi, I'm taking the specialized in biological right now. I'm planning to take medicine in nursing. Will be no, you will be for Lynn Valencia, you will be considered RN, because nursing practitioner, you need to really do the nurse practitioner master. Monica, Jewish is bilingual. So there are monolingual hospital, right? So Jewish is bilingual, but it's under English system. You have in Montreal, you have English system hospital, and what else? You have the English system. So all the hospital that's under McGill, that's English system. So they are kind of more nice to the nurses. And then you have the French system, that's which all the rest of the hospitals that are not belonging to McGill. So yes. And team, and sorry for YAHPA team, please remind me if I don't have time, okay? Do you have to do the 3,000 hours of clinical experience before becoming a nurse practitioner or after doing the master's degree? I need to earn the 3,600 hours before I even apply to the master program. It's to make sure that you have enough clinical experience. And since I'm doing nursing practitioner for adult care, I need to do it this 3,600 hours within adult care ICU. If I want to do pediatric nursing, this 3,600 hours need to be in pediatric. If neonatal, it would be in the neonatal with the premature babies. If I want to do psychiatry, I need to do it with the psychiatry patient. So you need to decide like pretty fast which clientele you like. So you need to accumulate these hours as soon as possible. Like I know I cannot deal with adolescents, so pediatric is not for me, psychiatric is not for me, so I have adults patient left, so I need to do my 3,600 hours within adults ICU. And in the end, I would like to give a big thank you to all of our speakers. Actually, can you the slides please? Yeah. to our speakers, Vida Siu, Mahua Cafe, Justin Pham, Angela Lo, Nancy, and Belinda Jiao. And also a big thank you to Elite College who sponsored this event, and all the collaborators, AAA Sport, Marianopolis Chinese Student Association, McGill Chinese Graduate Student Association, Chinese Student and Scholar Association at the University of Montreal, Lingua 3660, McGill Chinese Mental Wellness Society, College McGill, Quebec, Chinese Volunteer Association in Canada, Filipino Organization of Concordia University Students, Canadian Federation of Chinese Students, Chinese Psychology Student Association, MTL Education Forum, and United Vietnamese Student Association of Eastern Canada. And big thank you for YAHPA support team, Yuxin King Fei, Melissa, Tianzi, Teddy, Natalie, and Jessica for making this event possible. So see you guys next Saturday. Thank you very much. Oh, yeah, survey, guys. If you guys can complete the survey, it will help us a lot. Or if you guys have plans to attend to next Saturday's event, you guys can wait until then. But please complete the survey as soon as you can. Thank you.